Alberta outbreak, the Ontario Ministry of Health has just released a statement to warn the province of a potential epidemic of pertussis, more commonly known as the whooping cough. Some parents will have more than the usual cold and flu to worry about this season, as this possibly fatal disease makes a comeback, specifically attacking the very young. Pertussis, being a very highly infectious respiratory disease, is marked by a severe hacking cough followed by a high-pitched intake of breath. This is caused by the bacteria releasing toxins known as porcins, which damage the cilia and cause the airways to swell and become inflamed. This leads to an excess production of mucus, further irritating the respiratory tract, causing the high-pitched characteristics of the disease. Let's go to Dr. DePalma at St. Kitts Hospital, who specializes in respiratory diseases.
Thanks, Laura. Although many of the characteristics associated with whooping cough are similar to those of a common cold, pertussis is known to have the most severe symptoms and longest recovery time. This is due to the 3 distinct stages associated with the disease. Beginning with the catarrhal stage, the symptoms usually last 1 to 2 weeks, with symptoms consisting of a fever, loss of appetite, runny nose, irritating cough, and sneezing. This point is often where parents can have a misconception when assessing their child's condition. Most will pass off their symptoms as a common cold, when really something far more dangerous is lingering within them. Moving on to the proximal stage, the cough can last even further than 1 to 6 weeks. Symptoms during this time include severe coughing, a buildup of mucus, and the high-pitched whooping sound that makes this distinctive from the rest. Vomiting can further be triggered due to the severe coughing or choking of the mucus. The final stage is a convalescent stage, which shares all the symptoms of the previous 2 stages, however, to the extreme. It is this stage of a person's suffrage that gets this disease its notoriety as the 100-day cough.
Wow, with the name 100-day cough, one can definitely see the severity and emphasis on the long road to recovery for these patients. Let's go to Samantha outside Etobicoke General Hospital.
Thanks, Laura. I'm here with Michaela Dews, mother of 6-month-old baby Ava, who is currently recovering from this life-threatening disease. So, tell us about your experience.
It's been a very difficult few weeks, but I'm just glad to know that my daughter is getting the best possible treatment that any parent can hope for.
I'm glad to hear that she's getting better, but why did you bring her to the hospital? What made you decide this was more than just a regular cough?
Well, when the symptoms carried out for more than 2 weeks and the cough became very persistent, my husband and I knew that this was much more severe than we both thought. I noticed on the news a few weeks ago that there had been a whooping cough outbreak in Alberta, and this spiked my concern.
Yes, Canadians have sympathized with the hundreds of citizens in Alberta who have dealt with this ongoing epidemic. But as Ontarians, how can we prevent the spread of this disease? Well, immunization is essential. The whooping cough vaccine not only protects against bacteria pertussis, but also against several other diseases. Children are not fully protected until they have received 3 doses of this vaccine and can receive it as early as 2 months of age. Children who are not vaccinated are 23 times more likely to develop whooping cough. Similar to other vaccines, adults must receive the Tdap vaccine every 10 years. Other simple ways we can avoid the spread of pertussis is to cover your mouth when coughing and sneezing, washing hands as often as possible, and avoiding close contact with people who are sick.
Keeping these preventions in mind, covering your mouth when coughing or sneezing is how this disease is transmitted. Tiny droplets containing the bacteria move through the air and are spread through the airborne droplet contact transmission. This results in the pathogen residing in the mouth, nose, and throat of humans as it moves towards the upper respiratory tract. The less common mode of transmission is through direct and physical contact with an infected host.
That's right, Laura. Most recover with no complications. However, some do arise when treated incorrectly. Some may experience a swollen face, broken blood vessels, and cracked or bruised ribs. In fact, 1 in 11,000 people receive brain damage, and 4 in 1,000 people lose their lives to this disease. Infants may experience pneumonia, seizures, hypotension, or dehydration. Luckily, patients like Ava can avoid these complications if they seek medical attention in the early stages.
These complications will not occur if patients can seek the right treatment, as medical attention is the best option to cure this disease. It may include administering oxygen, suctioning mucus, administering fluids to prevent hydration, and isolation to impede the spread of this disease. To keep in mind, if you experience severe symptoms of the whooping cough, it is suggested that over-the-counter medication such as coughing medicine will not help.
And that's the CBS News for tonight.
From all of us at CBS News, have a great night.